Welcome back. You are watching Prime Edition and thank you for staying with us. We continue with the day's news. Healthcare facilities have been challenged to embrace an alternative mode of disposing of hospital waste from the traditional waste incineration. According to air quality experts, waste incineration is becoming inefficient as it is exposing the public to harmful pollutants. The experts who were speaking during the closing of the 3-day conference on clean air in Nairobi also emphasized the need to strengthen health policies and regulations that will in turn foster compliance and enforcement in these facilities.
Hospital waste has emerged as the second highest source of air pollution due to its open burning process.
Because incineration uses a lot of electricity at very high temperatures. The pollution from incineration is worse than a coal-fired power station for the same energy amount.
Air quality experts, researchers and scientists drawn from across the globe attending the Clean Air Forum in Nairobi are now pushing for the urgent prioritization of proper hospital waste management that is slowly becoming a nightmare.
Because it has very dangerous chemicals, including the dioxins and furans, which are a huge source of cancer in the city.
It's this invisible killer that does a slow death, because we don't immediately start I can breathe now, but the air quality might be detrimental to my health.
The environment conservation stakeholders emphasized adoption of alternative waste disposal methods and strengthening of relevant policies.
There is a lot of technologies nowadays that can be used to manage this, including autoclaving, microwaving, that kind of reduces or remove the infectious state of the waste.
Government is an important player in saying this is the law and everyone needs to adhere to the law.
With this year's theme being Partnerships for Clean Air Solutions, experts shared hospital waste disposal technologies used in their respective countries.
They introduced color-coded segregation. So in major hospitals in Kampala, waste is segregated in different containments.
Community recyclers who are able to pick some of the recyclable, who are able to pick some of the things that can be reused or recovered. By the way, very little will be able to go to the incinerator.
These, even as they called for more funding to the sector, which they termed as forgotten, yet it contributes hugely to climate change.
If you look at the reports from the Clean Air Fund, for instance, showing that only 1% of international aid is going to air quality projects. So there is still a lot to be doing there.
It's time that we targeted grants that are out there for climate change, since we don't have the funding to manage this waste.
Opicho Chemtai for Prime Edition.